My name is Robin Steele, and I'm from Mobile, Alabama, and I'm here in Bangalore, India. Just had completed a mitral valve repair, and my story started months ago in Mobile, and when it was informed to me that I had to do something about this situation because it was moderate to severe and getting worse. And naturally, I started my search looking at the expense of this because the symptoms of my problem I started 15 years ago, and I lost my insurance over this, and I just depended on being in good physical condition. But this gets you anyway in the end. And so this past year I had more and more irregular heartbeats and things of that sort resulting from this mitral valve problem. So I decided to find out what I could do. I started in the United States and quickly found out that the price could be anywhere from $100,000 to $300,000, and $100,000 would be probably not the end if I chose that one. But a surgeon friend of mine informed me that whoever you got, get someone that has done thousands of these or hundreds of these. And I said, do you know anyone like that? And she said, I don't. But there are some at these clinics, but they're very expensive. So having been to India before and traveled extensively, I know how competent the society is, and I wasn't afraid of anything. And I talked with several of the leading physicians in Southeast Asia. And then I talked to Dr. Vivek Javali at Wockhardt Hospital in Bangalore and found him to have been the most qualified of all the doctors, and probably very few in the United States that is qualified as he is. So the best part about it, it was a fraction of the expense. And so I made arrangements to take this trip, and not really knowing a lot about Wockhardt, I found out after I got here it's one of the few internationally JCI-approved hospitals in Southeast Asia. And I've been in the hospital as a result of my problems before, but never experienced anything like this. Their attention to detail, the timeliness, their smiles, and often it was almost too much because they wanted to monitor me in the effective way, which means entering my room often, and I couldn't get a lot of sleep, but that was in my best interest because I just recovered from this heart surgery, and I had it repaired, which is exactly what I wanted, and I had an ablation, a Cox-4 ablation, which Dr. Javali is the only one I knew that could do this, the only one that I talked to, and the only one that guaranteed me a repair. And so I would like to say that if I had another problem, bone and joint, I understand they have that this would be where I would go, even if it was the same price in the United States. I have so much confidence in these people, and these statements I make, I'm not making lightly because I'm a very careful person, and I research and look at things. And this was the best I can come up with, and this, I'm so satisfied with it, beyond my expectations. So I encourage anyone that's looking that in the same situation that I had, that doesn't want to lose all their children's retirement money or their children's money for college or things like this in trying to fix their physical repairs, to look at Wockhardt Hospital and see if they have something available that can deal with their illness. I'd noticed, having been in the hospital as a result of my heart problem many times, and some of these hospitals had quite good reputations, and they did good jobs. And I thought of that as the standard, and I was looking for something just exactly like that. But I will have to say, when I got to Wockhardt, there was a lot of from the best that I'd been in, a lot of that, but more of it. And so these employees were doing the things that the best hospitals did, but more of it, giving me more of their time and more of their experience and paying attention to my aches and pains, which is, if anyone's ever been in the hospital, it generally is not a pleasant stay. First of all, you're sick, and then the rooms are drab and not very nice. Now, when I walked into this room in Wockhardt, the room was like a suite in a nice motel. If someone had asked me and I described all the things that I just told to you, or I had asked them, where do you think I've been, if they noticed my absence, they might have said some spa somewhere, not a hospital getting a valve repaired at 1/10 of the price it would be in the United States. So I'm just thoroughly satisfied, and to sum it up is that it just couldn't have been any better than what I experienced.
Mr. Robin has come from a very long distance from Alabama. He had a severe mitral regurgitation, a mitral valve leak with long-standing atrial fibrillation, a disorder of heart rhythm making the heart beat irregular for a long time and requiring warfarin, anticoagulation all his life. He has done a lot of research on his own illness and treatment facilities and treatment options for himself. He called me and he discussed with me at length over long distance, and he wanted a mitral valve repair and not replacement, and an operation of the maze operation for his atrial fibrillation, and wanted to get back to normal sinus regular heart rhythm, get back his natural valve, because it is possible to do that in a mitral valve situation. He'd done a lot of research, talked to many surgeons all over the globe, and then he zoomed down on Bangalore to come to us. We have done a complex mitral valve repair for him. Both his anterior mitral leaflet and his posterior mitral leaflet were flail and leaking. They had chordal lengthening. I had to go in, stop his heart, fix up his posterior mitral leaflet by doing a wedge resection and suturing, and do chordal shortening by doing a basal chorda transfer for his anterior mitral leaflet, and then fix the mitral annulus by a Carpentier physio mitral ring. We got an immaculate, beautiful result for his mitral valve repair. He has no mitral valve regurgitation on his post-operative echocardiogram. I have done a maze, Cox-4 maze operation for him using cut and sewing, and also radio frequency ablation on his right and left atrium, and that has given us a wonderful result. He has a nice low heart rate and a normal sinus rhythm of the heart. So he has got what he wanted, a mitral valve repair and not replacement, and a maze Cox-4 operation and a normal sinus rhythm. So now Mr. Robin will go back to Alabama. In a month's time he will join back his work. In 2 months' time he will be robust, and in another few months he will be without any medicines, eating normal food, doing normal work. He will have a good longevity and a normal quality of drugless life. I wish him very well, and we feel very happy that he chose us for this complex job all the way in India.